Hello, everyone. It's Wednesday, July the 15th. I've got to report to you that we've lost another West Virginian. We lost an 85-year-old female in Ohio County. It's our 97th death in West Virginia. All of us can surely see that we're approaching 100 deaths. And if this thing keeps on going, we'll probably go even significantly higher. You know, thank goodness we're moving very, very slowly, but that doesn't matter too much to this family of this beautiful lady that had a great life of 85 years, but probably more life left in front of her if she didn't, contact this terrible killing virus. She's a somebody, and she's a great West Virginian that we'll miss. And so I ask all of you to join Kathy and I in our thoughts, our prayers for this family, all the loved ones. This is not a number, and as we go forward, the numbers are going to get worse, but the names are going to be really bad. And so West Virginia, we now have the most active cases that we've had thus far, 1,371 active cases. We have new cases of 145. And a daily rate of 3.99. Now that sounds terrible. And in my world, that's the way I want to think of it, is terrible. Because if I think it's terrible, I'm going to really react. We have only 59 people that are currently hospitalized. And we have an incredible amount of people that are getting this terrible disease that are young people. I've been sent this right here, and Jordan, if you'll put this chart up, please. This is in Mon County. We now have 436 of our cases in Mon County out of a total of out of a total of 1,371. That's a third of the cases that we have in this state are in Mon County. But look at the numbers. Just think about this. Those that are between ages of 18 and 29 are 321 of the 436 cases. What does it tell us? It tells us that the most probable place for that age group to maybe, have this disease, contact or to get this disease, and would be in a bar setting. And the bars, we know, are the number one place that we had to shut down. Now, we shut them down for 10 days. We may very well have to extend that. The odds are we're going to have to extend it, especially if our numbers continue to climb like they are. Now, also, on the good side, I said we had 59 that were hospitalized today. In addition to that, we still are absolutely pitching good numbers compared to all the other states and surely all of our bordering states. Now, our cumulative positive number today is 2.07. If you'll remember back when we said if we can get that under 3, that's what we want to do. We had it down to, I think, 1.67. The number of tests that we have tested so far in this state are 215,450 tests. We're now trailing slightly behind the national average, but very, very significantly ahead of all of the border states that are all around us. Now, as a reminder also, we have closed our fairs and festivals and our outdoor concerts. And in addition to that, we are limiting the number of gatherings, and that gatherings is very, very, very vague, and you should fall back to our website and follow guidelines. It does not apply to our essentials. It is honestly just a gathering of folks and gathering of people that we're trying to discourage and trying to limit that gathering to 25 people. Now, in regard to our face coverings, on the Thursday before the 4th of July, I thought that was the day to move. And yet we needed to give some level of notice to our businesses and to our people to get ready. Now, we also wanted to see more data, and the more data came on Monday and over the weekend. And all of a sudden, we could see a real spiking right over the weekend. Now, that spiking had to be 7 to 10 days or 14 days prior to that weekend. But we saw it. And so what did we do? We asked everybody in our state and made it mandatory and asked everybody in our state and made, to be able that they have to wear a face covering. Yesterday, as in true fashion, from the standpoint of what has happened over and over in West Virginia, and I'm very, very proud of this, and West Virginians, please, you should be very proud also. Yesterday, the CDC followed our lead and is now officially calling for all Americans to wear face coverings to prevent the spread of COVID-19. The CDC director said cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus. All Americans have a responsibility to protect themselves, their families, and other communities. Now, just think about it. Again, West Virginia, you were the first in the nation to shut down the visitation to the nursing homes. You were the first in the nation to move in a way that we tested all the residents and staff at the nursing homes. The first in the nation to move on assisted living testing. Absolutely, West Virginia, you have done an incredible job in corrections. I doubt there's a state in this country that has 0 deaths in the corrections facilities. And you have that, West Virginia. And now the CDC follows us again. This little state of West Virginia is being followed by Walmart, followed by Sam's Club. They just said that they're going to require all their shoppers in all their stores across all the country, beginning July the 20th, to wear face coverings. West Virginia, within the last couple of days, Ohio and Kentucky have followed the same suit. You, West Virginia, are doing the right things and pushing the right buttons. Please encourage those West Virginians that think, that they're either it is my right to not wear a mask or it is not the American thing to do to wear a mask. Think about what the CDC in this country just said. Their words, all Americans have a responsibility to protect themselves, their families, and their communities. We've got free testing going on today, this week in Barber, Mercer, Berkeley, Jefferson, and Mon counties. You'll see it up on the screen, where we are and the dates. And please take advantage of this. At this time, the more data, the better off we are. I say it and say it and say it. And I've got a note, you know, that okay, I just got a note, and it said, today President Trump has asked the National Guard, you know, and you know, to obtain data collect data from the hospitals and everything, and you know, to be able to process that data. And the bottom line is, guess what? Our great National Guard's already been doing it, and I salute them in every way. They have been troopers beyond belief, and what an incredible job they've done. I want to talk to you about our grants, and you know, that are up on our website. Our cities and counties from the CARES Act now have received in excess of $42 million. We have 148 applications that we're processing that are in thus far, and those numbers have been awarded. And so I just continue to ask everybody, apply, and we'll just keep pumping more and more money out. Our unemployment numbers in the state dropped by 2%. They're down to 10.4% in the state. It's an enormous number. We have decreased by 21,400 people, you know, and the national unemployment level is at 11.1%. We're at 10.4, slightly better. We got a long ways to go to get all these people back to work, and we're going to work it as hard as we can to achieve exactly that. Again, I want to thank our West Virginia retailers who have stepped up to offer special accommodations to shoppers that are at high risk. Some are offering special shopping hours or delivery or pickup options to protect those that are absolutely the most vulnerable. I thank all the stores across West Virginia for taking the right steps to make sure West Virginians are protected and safe while they're shopping. So thank you to all the retailers. Our summer feeding program is up in its 690 spots. I tell you over and over, but if you have an issue or a problem, call 211 and we'll help you. We don't want any West Virginians not getting fed. Now here I've got an incredible number to report to you. If I were to say to you, what is the total number of meals that we have provided to school children since March? What would you think? What would you think if I said, what's the total number of meals that we have provided to school children since March? Now keep in mind, in West Virginia, we only have just under 1,800,000 people. That's the total population. You realize since March, we have delivered, we have provided to school children 13,508,800 meals to our school children. And I can't thank our Department of Education, all of our county boards, all the community partners, all that have stepped up, all the volunteers, all the food sites. Man, gracious, what a wonderful job you've done. 13,508,800 school meals to our school children. It's amazing. It is absolutely amazing. So way to go, you know, all you great West Virginians. The census numbers, you still got to get counted. There's other states now that are beginning to push their numbers to get their people counted. We've been doing it. I'm proud of you, but we're still behind the curve. We got to go a ways to go. So let's get with it and get ourselves counted. Now, the last thing I've got, you know, is just this. I'd like to go over, you know, I'll go over our charts real fast with you in just a second, but a former, and you've seen this if you've been watching the news, but a former nursing assistant at the Clarksburg VA Medical Center has now pleaded guilty to killing 7 of our veterans by injecting them with insulin. You know, there's some bad people out there in the world, there really are. And, you know, it's hard to fathom. The very people that we owe everything we have to, why someone would do such a hideous thing, I can't fathom it. But I absolutely, again, ask you to join us in our prayers for these great heroes that we lost by absolutely a hideous act. And so please continue to pray for these people and all their loved ones. It's awful beyond belief. And so I don't know anything else to say other than that about that. That's just terrible. Now, the last thing is I'm going to go to our graphs real quick, and you'll see their top line up there, you know, our top graph and everything, that our recovered cases are growing, but our active cases are chasing them, and they're too close. You see where we really widened and everything, and then all of a sudden we started moving the wrong way. And that's why we've reacted by doing the mandatory mask, closing the fairs and festivals and the concerts, closing the bars in Mon County. We'll do whatever we have to do to get those lines to move and move in a better way. As you'll see in the next graph down, you'll see us on today, we jumped back up to 3.99. Over the weekend, we dipped down there for a day, and that was moving, but it's not super terrible, but we got to watch. We got to really watch. And you'll see down in the bottom that our cumulative average at 2.08, you know, has tipped down just a little bit. That's because of that day over the weekend, you know, where we dropped back. But the only other thing that I would add is we're still tweaking just a little teeny bit on our small business grants. I think this afternoon, everything will be up and we'll be running full throttle. I've got just a little bit of a discussion that I need to have with J.B. McCuskey. We're trying to find him and everything, and where I can talk to him just 1 second and everything, and then I think we're ready to go. So with all that being said, I think that's all I've got right now. You know, I would tell you as West Virginians, please, 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 keep up the miracle, keep up the great work you're doing. You have been first in the nation. It's a really wonderful thing to be able to tell West Virginians that they're first in the nation. We went for decades and decades and decades, and that wasn't the case. So let's keep at it, West Virginia. Thank you.
All right, thank you, Governor. Let's first go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Just to update folks about what's going on in the country and the world related to COVID-19. We, for the very first time during the pandemic, have had a 7-day average of positive cases exceed 60,000 in our country. And as we look at the world, in 5 days, we saw 1 million new cases of COVID-19 come up. As the governor said, the change in the age grouping of people that are starting to test positive is quite noticeable around the entire country, as well as what the governor has communicated for West Virginia. And we see the age group of 20 to 40-year-olds growing the fastest in our country. Now, many people might say, well, these people have a better outcome, they have a free ride, we don't worry about them getting sick and dying. But that's actually not true at all. And for the states that we've seen having very large spikes like Florida and Texas and Arizona and California, there are 20 and 30-year-olds in their ICUs. And for the first time in about 2 weeks, we've seen the death numbers start to rise in the US as well. So it's really important that people that are younger not be fooled or confused that they can't get sick as well. And certainly as we look at this group of folks, we know, as the governor has said, that this is a particularly important group of young people to help be aware of the great importance of wearing face coverings and socially distancing and also washing hands and really trying to adhere to these principles. West Virginia has moved one notch lower on the reproductive value. We are now the fourth worst in the country. Remember, 2 or 3 days ago, we were number one as the worst in the country. Our t-value is 1.31, which is slightly improved, but we need to continue to practice those really aggressive mitigation measures to continue to be able to reduce that. COVID has also started to see its way into more rural environments. The governor of Oklahoma has become the first governor in the country to test positive for the coronavirus, for COVID-19. And as we have heard from the governor, a number of state legislators in Mississippi, as well as a number of other people and other business elements have suffered from being infected with COVID-19. And I'll finish up by really reiterating the really important findings and new rules and regulations that have been pushed out by major businesses in our country, including Walmart, that's now going to require everyone to wear a mask inside their businesses, and also the Centers for Disease Control that has articulated very clearly that wearing a mask is the most important thing we can do. Now, 2 pharmaceutical companies, Moderna Pharmaceuticals in Cambridge, Massachusetts, and also the University of Oxford, working with AstraZeneca, have both completed phase 1 studies on their vaccines. The phase 1 study from Moderna, which really tests for toxicity and safety, was given, this drug or vaccine was given to 45 people in 3 groups. And all the people in the 3 groups were able to tolerate the vaccine on a repeat dosage. And most everyone got antibodies, which is what we're looking for. The University of Oxford in England has completed their phase 1 study using more people, 1,000 people. And now they're on to their study of looking for benefit and resistance to virus, which is their phase 2, phase 3 study, of which AstraZeneca is already planning to try to generate 1 billion doses. So we're making headway in some of the vaccines, but it doesn't reduce the need for our people in West Virginia, as we've talked about, to be very, very, very focused at trying to protect yourself and each other. And as the governor said, we've done well so far. And as we continue to work together, we can still be the shining light for the rest of the country. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Crouch and Dr. Amjad, our State Health Officer.
Good afternoon, everyone. I want to announce that DHHR's Bureau for Children and Families has delayed the application period for the school clothing allowance program due to COVID-19. The program provides funds for eligible West Virginia children to purchase clothing and shoes for back to school. Funds may also be used to purchase piece goods to sew clothing. The good news, part of the good news here is also that this is being moved to an electronic format to allow recipients to make online purchases to try to help keep folks safe and not require them to travel into a store. This was previously limited to in-store transactions. The revised dates for the school clothing allowance application period, as well as new guidance, will be regarding online shopping, will be coming out in the next few weeks. We've been happy to operate this program, and in the previous year we provided services to more than 42,000 West Virginia families. So we'll get more out on that soon. Thank you.
All right, thank you. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As far as testing, yesterday we supported our local and state partners, tested 750 people in the Clarksburg area. As the governor pointed out, we've exceeded 12% of our state population in testing. We're preparing this weekend for a number of test lanes throughout the state of West Virginia. We also yesterday completed sanitization missions at churches in McDowell and Raleigh County. Also want to point out to our citizens that National Guard members continue to train, and significant amount of training going on over the next 2 months. Units also returning from deployment. Some units returning today, and over the next couple of months through September, we'll have units returning. During my visits with both those training and those returning from deployment, I appreciate, as does the governor, the discipline and leadership we're seeing on part of our National Guardsmen, using PPE, practicing social distancing and sanitization, as well as their families during the homecoming, and we appreciate their leadership in that regard. As the governor pointed out, there's some national discussion about National Guard units helping collect hospital data. And as the governor pointed out, I think it's important for us in West Virginia to understand for 124 days now, the National Guard, DHHR, and others have been partnered not just with the West Virginia Hospital Association, but with our long-term care partners as well as our retail partners in collecting data. So we collect data from and receive data from the Hospital Association, important data daily. Also includes PPE burn rates, so we understand what our PPE issues are. We collect data and receive data from our long-term care partners and partner with them on training. And as the governor pointed out, a lot of great work with our retail partners, understanding supply chain issues. So we appreciate the work of all those organizations, their partnership, as well as the partners that the governor pointed out with the school feeding and our senior feeding. Thank you.
All right, thank you, General. We'll now go to questions from members of the media. The first today is from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Sorry, a little delay in unmuting. A couple of related questions. Can you describe the status for the portal for small business grant applications? How's that going? And also, what has happened to the legislative task force that you alluded to a few weeks ago that was guiding the use of the $1.25 billion? Is that an official standing group? Do they intend to meet some more? Thank you.
Okay, Brad, let me answer the second question first and everything, but what we did, you know, if I remember correctly, we picked, we let them pick, you know, one from each side of the aisle in the House, one from each side of the aisle, you know, in the Senate. We all got together, we discussed things and everything, we went over the plan and everything. We're getting feedback from different times, you know, from different ones. You know, that's what's led us to probably some of the switch, if not a good bit of the significant switch in the broadband situation. And so we're continuing to take input. I welcome the input in every way, and it just makes us better. You know, so from the standpoint of us working together and being able to help one another and solicit input, I have welcomed that from day one, and I think that it's pretty tough to argue, you know, the way that we have set this thing up and what we're doing from the standpoint of getting money to the cities and counties, you know, getting money into all the different places that we need, where the money needs to go, and yet keeping our arms around everything to make sure that we're absolutely doing it in a prudent way. So I think all that's working and working very well, and in fact, I think we're going to have some further discussions even this afternoon. Now, in regard to the small business stuff, I wanted to have one more quick discussion, you know, with our state auditor J.B. McCuskey and get some more input from him. But here's one stumbling block, and this is a stumbling block: is how can you be an entrepreneur, and let's say you had a barbershop, and what you were doing, you were not paying yourself, but what you were doing was you were deriving your income from the profits of your business as you went forward. How do we take care of that person when they're not really registered with Workforce West Virginia as far as having an employee, you know, but yet their employee really is themselves? And how do we take care of that person? Because we want to. We really want to. And we don't know how to count those people as of yet. And so what we're going to do, we're going to go ahead. We've struggled with trying to figure out how to do that and everything, and we're still working that. But what we're going to do is we're going to move forward right now with anybody that has a registered employee 1 through 35 with workforce and start pumping that money out, and we're going to have the guidelines up this afternoon on how you can apply and go with exactly that. But we're going to continue to work and figure out a way that we can help that person that is the person that I just described. The biggest thing we've got to do is try to figure out how to track and how to eliminate the possibilities of fraud. And we're working that, and we're working that as diligently as we possibly can. But between all the people that are working on it and everything, and especially, you know, the auditor's office and everything, because they've got to pull a great big load in this and everything. And so JB and I are working, you know, hand in hand, as well as his people and our people, and lots of different people that are working on this. But the net of the whole thing is we're going to move forward with 1 employee through 35, and we're going to continue to work on a way that if we have dollars left over and everything, of which we know we're going to have some dollars left over and everything, that we can jump back and help the people that we're talking about. Because each and every one of these instances, you have to show a need. You have to show a need or an impact of COVID, you know, that has impacted your business. So you know, all those guidelines should be up this afternoon.
All right, thank you, Brad. Next, we'll go to Taylor Stuck with the Herald Dispatch.
Hi all, it's Taylor with the Herald Dispatch. This would be a question for one of the health professionals. I was wondering what the recovered cases look like in West Virginia. After you recover, do you still have some symptoms? Are there complications that we're seeing in our West Virginia patients? That's what I was wondering.
Dr. Amjad and Dr. Marsh, take over.
Ayn, do you want to start, or you want me to?
You can go first.
Okay. Well, as I understand it, and Ayn or Bill Crouch will correct me if I'm not accurate, but the recovered cases are cases in which the local health departments have followed these people through the defined part of their illness related to their infectivity. And once they are done with that case contact tracing and illness time in which they are no longer infectious, then they go off from the active cases to the recovered cases. One question that's popped up on social media, which is something that I think that we need to look into, although I'll defer to our other experts, is whether or not these people have long-term follow-up related to any kind of morbidity or side effects or residual problems they might have contacted or contracted through the time that they had COVID-19. But I'll let you or Bill take it from there.
To answer some of your questions, Taylor, because we don't know too much about the disease right now, some things that we are running into are depression and anxiety, especially with their family members, because the disease is, easily spread throughout families and community. A lot of patients we've encountered are having depression and anxiety because it's such a disease that is spread. A lot of patients we have talked to and even their family members suffer some depression. I would even call it PTSD type symptoms. Also a lot of fatigue. I wouldn't be surprised if we run into something of a disease similar to chronic fatigue. And then because we're also seeing a lot of issues with possible bloodborne diseases, we're seeing people who've had strokes, questionable blood clotting disorders. We don't know how it's going to affect that system. So because it's so unknown, I think we're going to find a cascade of illnesses that we don't know about. But there is some depression, some anxiety that we're seeing post-COVID, but we're not having a lot of information yet. We're going to have to see what I think family doctors are going to run into post-COVID, but I know at least right now we are seeing those types of illnesses going on, and we're going to have to do a lot more follow-up with these patients post-COVID.
I'll just
This is Bill Crouch. That's an excellent question. The recovered cases that you're looking at and that people see on the dashboard are really what Clay referred to as essentially the end of the viral load, the end of the virus portion of the illness. But we certainly know there are people out there who have long-term impact from this disease. That's really not something that we're tracking very well right now in West Virginia, but it's something that's on our radar to look at in the future.
All right, thank you, Taylor. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, once you get the portal up, and it's been a kind of a stop and start and herky-jerky process, but once that portal for small businesses goes up, when do you anticipate the money will actually be going to the people who need it?
Well, Kenny, I got to say this, in any way, first of all, I don't know that I disagree with you on the herky-jerky because, but we're trying to do it right, and to just send out $150 million, and remember, our small business community are the people that should have been the recipients of the PPP monies too. And so we're just trying to help those that need an extra little bump and everything. And so but to put this thing together from scratch and to be able to do it in a way that we can avoid most of the fraud situation and to pump out the money as quickly as possible, I think that, especially from the standpoint that government is known for making $400 commode seats, and we're sure not making a $400 commode seat here. We're moving it in government terms in light speed, but it's still not fast enough. And but I'm very, very hopeful that the dollars. I don't know the exact timeline, but I'm very hopeful that the dollars are going to be flowing very, very quickly now.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's for Secretary Crouch. Secretary, the other day when you spoke in front of members of the House of Delegates, you talked about some changes that you'd like to see to the dashboard and the way the COVID data is reported. You mentioned going to a once-a-day data release instead of the bi-daily that we have now, and some other features that you'd like to see added. Are those just your hopes, or are those something that we can expect in the future? Thank you.
Thank you, Charles. That is a great question. I did say that's the direction I think we need to move, and we actually have a group of folks, and Dr. Amjad is kind of leading that effort to look and see what changes we should make. I believe we should have active new cases come up daily and not have to look at a 10 a.m. and a 5 p.m. Number to do math to get to that number. I think we're to the point in the progression of this disease where one update a day is really adequate. It eliminates a lot of work for folks who try to get this data together, and really becomes a little more accurate in terms of looking at numbers one time a day. So there are quite a few other changes we're looking at. We want to make this, as we have since day one, just open and transparent to everyone. So we want to try to get good data out to everyone. So we are looking at that. We have a group of our data experts and medical experts comparing notes on that. So we're working in that direction.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers, and I hate to go into this topic again, but by my count, there are 26 members of the House delegates, Republicans, that are wanting to be called back into session, and they have signed documents to do that. Another 35 members of the House of Delegates, Democratic members of the House of Delegates, have also asked to be called back into special session and have said that they will join those 26 Republicans in calling themselves into special session. You need like 3/5 in order to do it. They've got more than 60 members in order to do that. It remains to be seen about the Senate side, but Senate Democrats have signed a letter and sent that in a day or so ago to you also being asked to be called into special session. They're pretty close to getting the numbers to be able to call themselves into special session without any type of proclamation from you. So do you want to call them back into session to where you can control the agenda and set what they do, or are you going to wait on them to call themselves into special session and be able to take a look at some of these things that you're doing, such as the CARES Act funding and other issues? Thank you.
Well, Stephen, let me answer that this way. You know, first of all, I'm going to continue to work with them. But, Stephen, I do want you to know just this, that I can't imagine, because I've not ever heard it. I've not ever heard any one of our citizens that are out on the streets that are concerned or wanting us to call ourselves back into session, or me to call us back into session to see how to administer the funds or whatever like that. Because you know, and I know too, what this is all about. It's a political move, you know, and really at the end of the day, our citizens are concerned about how are we going to go back to school? Are we going to go back to school? You know, what's really going to happen to my grandmother, you know, if these positive cases continue to grow? What is really happening within our state? Am I going to have a job? Am I absolutely going to be able to feed my family? What's happening all across this country? Do you really think that our citizens, you know, that really believe with all their soul that what we have done in West Virginia is we have created a miracle? I've said it over and over and over to you. You know, we have incredible numbers as far as the medical end of what we've done with COVID. We all know that. And I have given you my soul every day that I'm here. Every day I tell you over and over, ask any questions you want. I have absolutely worked as tirelessly as I know I possibly can, along with all of you. And what we have done is we have produced this miracle. But the number one thing we have done, even above the miracle, is we have done just this. We have brought ourselves from June 30th to July 1st of last year in the worst pandemic situation imaginable, and we have done so with economic numbers that are a surplus. We have absolutely backfilled our Medicaid reserve fund. We have done exactly what we should do. There's no pet projects. There's no pet projects of gyms or anything in the CARES Act money that I've put out there and said, here's the way I think we should spend it. We have absolutely worked hand in hand with the legislature, from the Democrats and the Republicans on the House side and on the Senate side, and said, give us any of your input that you want to have. From my standpoint, you know, calling us back in is unnecessary, it's expensive, and absolutely it's going to just cost the taxpayers of this state dollars. And at the end of the day, you have seen exactly what I've done and done every single day. Now, if in fact this happens, it'll have to happen on somebody else's watch from the standpoint of somebody calling us in other than me.
All right, thank you, Steve. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. This is Emily Allen with Public Broadcasting. I have two questions. First would be for Major General James Hoyer. I was just hoping to get some additional information on the sanitization efforts in McDowell and Raleigh County you had mentioned. And then related to schools, I know Clayton Birch isn't up there, but we know there's a substitute teacher shortage in the state. What would be the plan if a teacher tests positive and needs to be out of the classroom for weeks or months at a time?
Yes, related to the sanitization missions, we had two churches, and one in each county, that requested assistance to sanitize their facilities. I can have our public affairs folks provide you with additional information on the work that we're doing to support those churches and other churches as well.
All right. Well, thank you, Emily. We'll go next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is a question regarding the spike in cases and what we're looking at coming down the road here. Has the treatment gotten better, or are we expecting to see a spike in death rates as a result of the spike in case numbers? And I guess that goes to the medical panel here.
Okay, Dr. Marsh, Dr. Amjad, you guys handle this, please.
Maybe I can start if that's okay, Ein. So some data just came out about the mortality rates in states, and West Virginia currently, even though we've seen a number of fine West Virginians who have died, as the governor points out every day when we have another death in our state. But on a national basis, we average about 5 people dying from COVID per 100,000 population, which is actually quite good. And I think that the key for us in West Virginia, as well as people in or other states and other citizens, is to control the rate of spread of COVID-19. We know as long as we can control the rate, flatten the curve, not allow the surge to happen, that logarithmic spread person to person from COVID-19, then overall our death rate should be much, much better than if we do surge in like states right now like Florida and Texas and Arizona and California and even Oklahoma are starting to see. For instance, yesterday, the state of Florida had more deaths in one day than we've had total thus far. But I think that the concern that the governor has stated that we all feel is while there is a significant spread in younger people, and as we've said, younger people can certainly get just as sick and die of COVID like older people can, we are still the most vulnerable population in the country by the Kaiser Family Foundation. And the secondary spread, as we've seen in countries like Sweden that try to protect their elderly, their nursing home population, and then let other people sort of get the disease in a guarded, graded way, that didn't work so well. And you can't save and protect people in communities where the spread has gotten to be quite rampant. So it's really critical for us to be very, very resolute with our mitigation strategies, mask wearing, distancing, hand washing, eye protection. And I'll throw it to Ein for any other comments that she might have.
One way to avoid mortality or for deaths is to be able to catch up with the disease. And one way for preventing COVID deaths is to be able to detect it quickly. So being able to catch the disease quickly by testing is one way, because I believe COVID does not have to be that deadly. So one thing is if we can test people we suspect have the disease, test them, isolate them properly so we can quarantine, having enough hospital capacity, which also means having enough PPE for healthcare providers. That's one way to prevent mortality in our state. So if we can test people, isolate them, and then having capacity in the hospital, that includes having enough PPE for healthcare providers. So when we talk about flattening the curve, that means we want enough time for healthcare providers to treat the people in the hospitals, which will allow enough time to have other people enter the hospitals, whether they have COVID or not. Because I don't believe COVID has to be that deadly. It is a disease that we can possibly control if someone is sick. And that way it can also lessen the amount of people who are dying. That being said, our population so far, we have not had that many people die. Also, the people are young at this time. So it is something that we can catch up and treat if we can detect early, if we have enough supplies to protect the healthcare workers who are treating them. That way we have enough hospital beds to help anyone that is entering the facilities. That way it is something we can keep the numbers low. So if we have all that in our hands, it is something that we can control and keep the death rate low.
All right, thank you. Governor, I'll turn it back to you.
Well, it's July the 15th, the bad news is today is the filing day, and we surely want everyone to get their income tax filing in, and so please follow suit and get that done too. I really want to just caution you just a second and say just this is we're at a tipping point here, West Virginia, and that tipping point is really right at our hands. I've said it over and over. Here's our power. Here's our power. Here's our last bullet in the gun. This is all we have right now. And this right here is a power like kryptonite to Superman. This right here can stop this terrible killer. And so please, West Virginia, wear your mask. Please wear your mask. And I commend all those that are stepping up, all the businesses, all the people, everybody that have done just that. I want to just, because maybe if I didn't clarify it just as truthfully as I possibly could, or as clearly as I possibly could, I want to go back just a second, to Stephen Adams' question in regard to the possibility of calling us back or me calling us into special session. I welcome total transparency. I have done that from day one. I came to you driving my own vehicle with my own gas. I absolutely don't want a thing. I want to be transparent, and I want us to have greatness for West Virginians in every way. Now, from the standpoint, there's three things to this possibility of calling us back. First of all, like I've said, I think without any question, the people are concerned about, will we go to school? Will I have a job? What will happen to grandma? What will happen to my kids? Absolutely, I know that's the people's concern. And I have not heard one single person say, I think we ought to call ourselves back into special session, or I think we ought to go back into special session, because I have not heard a word about that. But I am telling you just this, there's three things you ought to keep your eye on the ball on. One is the fact that we have formed that task force. We absolutely solicited any and all information. We want to continue to have that information to come to us, and we will continue to try to make things better and better and better as we go. We're going to be meeting more and more. We're going to be meeting again this afternoon with some of the people and everything. We absolutely are soliciting impact, any kind of thought to come to us, input in any way. Now, that's A. B is, and I know too, that this is absolutely a solid, rock solid, nothing but politics. Nothing but political. Proof's in the pudding. Really and truly, from the Dem side, almost 100% of the Dems are going to vote with this. From the Republican side, you've got some unusual players, that are pushing this, But from the standpoint of a political move, it is nothing but political. I have tried with all in me, and I have given you the very best that I know to give in every way. I have tried with all in me to keep things from being political, to keep things to being transparent, to absolutely look out for all West Virginians in every way. I can't say any more about this from the standpoint of us trying to do the right things medically, to trying to do the right things economically, doing the right things to make West Virginia shine. That's what I want to do. And that's what you've done for me, West Virginia. You have made us shine. I can tell you these things, but at the end of the day, you had to do it. And you did it over and over and over. I could never, ever be any more proud of what you've done. And so I would say let's just keep doing it, West Virginia. You've done good stuff.